In this personal injury presentation, our medical team will share the 4 categories of documentation necessary to win a policy limit award for the soft tissue spinal injury claim and the financial drivers required to stop lowball offers. The top 4 categories of documentation include the top 5 financial drivers of Colossus Injury Award software, the 4 pillars of documentation necessary to win large awards, how to defend the pre-existing injury and the low-impact injury with low property damage, and the financial claim worksheet that converts documentation into the 4 injury award categories to support a policy limit award. The 4 injury award categories supported by our medical team documentation includes all medical diagnostics and treatment, the pain and suffering category, the permanent injury and impairment rating category, and the need for future care category. Let's start with how our medical team documentation supports the 4 major injury award categories for your client's soft tissue spinal injury claim for policy limits. Then let's move into the insurance adjuster's top 5 financial drivers of injury award software such as Colossus. In addition, we'll share 3 strategies attorneys can use to immediately stop lowball offers. We will also disclose how our documentation defends against the insurance adjuster's 2 arguments to minimize their financial liability and reduce your injury award. The 2 common insurance arguments are the pre-existing injury argument and the low-impact injury argument with low property damage. Then we will end with our financial claim worksheet and show exactly how our documentation converts the 4 major injury claim categories into a policy limit award. The following are the exact steps used by our medical team to document the financial drivers of a soft tissue spinal injury to support your injury claim for policy limits. Our medical team documentation is the same documentation that is trained by the world's largest chiropractic provider and used in every state, supporting thousands of soft tissue spinal injury awards. So let's start with the 4 major injury award categories and how our medical team documentation supports the soft tissue spinal injury claim for policy limits. The following are the 4 major injury award categories our medical team documentation supports. The first category is all medical diagnostics and treatment. The second category is the pain and suffering injury award category. The third injury award category is permanent injury and impairments. And the 4th injury award category is the need for future care. Each individual award category will not create a policy limit award. However, when you total each of the 4 categories, it will support a policy limit award. Then we will show how to convert our documentation into the financial claims worksheet and convert all 4 injury award categories, which will total a policy limit award. So the first category is the medical documentation necessary, which includes the mechanism of injury and the cause and effect relationship, a combination of subjective and objective findings, the patient's response to treatment, all permanent injury impairment ratings, and the need for future care. And the second injury award category is the pain and suffering documentation, and the necessary documentation includes SOAP notes and pain diagrams, activities of daily living indexes, functional capacity indexes, loss of enjoyment of lifetime activities indexes, and duties under duress indexes. Now, the third injury award category is the permanent injury and impairment rating category. And the documentation necessary includes totally objective diagnostics, maximum medical improvement determination, documentation based on the science of the 3 phases of healing, and impairments based on the AMA guides to impairments. Now, the 4th category, and this is typically the largest financial award category, is the need for future care documentation. Now, what is needed to establish the need for future care is the treatment needed for symptom care, the frequency of treatment, the cost of treatment, the patient's age, and the life expectancy. Now, in addition, our medical team documentation supports common awards such as medical-related expenses, missed work or other lost income, loss of family, social, and educational experiences, even emotional damages resulting from any of the above. And our documentation supports special damages, such as the more painful the injury, the more invasive the treatment, the longer the recovery period, or even visible permanent injuries. Doctors who do not document all the financial drivers will limit all 4 injury claim categories and significantly reduce your potential injury award. As you know, the personal injury attorney award will typically be determined by one of 2 methods, the insurance adjuster or a trial by jury. The good news is, with our documentation, the attorney can maximize the adjuster's injury award software or bypass their lowball offers and allow an objective jury to fully award the claim. In this presentation, we will share with you the documentation necessary for both, how to maximize the adjuster's injury award software, and if they continue to lowball your claim, the documentation necessary to win a jury verdict. Either way, our medical team documentation will enable you to negotiate with the insurance adjuster from a position of strength. So let's get started with how to maximize the soft tissue spinal injury award by way of the insurance adjuster. I'm sure you know over 80% of auto insurers use some form of claims processing software for determining compensation for soft tissue spinal injuries. The vast majority use the Big Four, which are Colossus, Claims Outcome Advisor, Injury Claims Evaluator, and Injury IQ. The reason auto insurance turned to injury award software programs is over 80% of soft tissue spinal injuries show the same 5 major financial driver categories. They also save millions of dollars by lowballing attorneys' claims who do not have the documentation necessary to support all 5 major financial driver categories. The primary support for Colossus Injury Award software is from the doctor's notes, reports, and narratives. The good news is a doctor who documents all 5 major financial driver categories is the single most important part of Colossus and support for your soft tissue spinal injury claim. The bad news are doctors who do not document all 5 major financial driver categories will force you to accept lowball offers, costing you thousands of dollars per case. Our financial claim worksheet shows how attorneys who process only 2 claims per month lose on average over $200,000 a year. And this is due to the doctors neglecting to document many of the financial driver categories. So let's get started with the top 5 financial driver categories of Colossus for the soft tissue spinal injury award. This documentation also includes how to stop lowball offers and the 4 pillars of documentation necessary to support large awards. These are the top 5 financial value drivers for a soft tissue spinal injury award based on Colossus and injury award software. The number 1 and highest award is the injury category or the diagnosis category. The second highest is the impairment rating category. And the third is the loss of enjoyment of lifetime activities. And the fourth is duties under duress restrictions. And the fifth